Hello, and welcome to today's medical discussion. We'll be talking about a condition known as pleural effusion, which is the accumulation of fluid in the chest cavity. We'll cover its definition, causes, symptoms, investigations, and management. Pleurisy, or pleural effusion, is a condition characterized by the abnormal accumulation of fluid in the pleural space, the area between the lungs and the chest wall. This space normally contains a small amount of fluid to facilitate smooth movement of the lungs during breathing. There are numerous potential causes of pleural effusion, including heart failure. The heart's ability to pump blood is compromised, leading to increased pressure in the blood vessels. This pressure can cause fluid to leak from the blood vessels into the pleural space. Both left-sided and right-sided heart failure can lead to pleural effusion, but it is more common with left-sided heart failure. In addition to pleural effusion, patients may experience symptoms such as fatigue, swelling in the legs, and shortness of breath. Lung infections. Pneumonia, which can be bacterial, viral, or fungal, can cause inflammation and fluid accumulation in the pleural space. This is often referred to as parapneumonic effusion. Tuberculosis, a chronic bacterial infection, can cause pleural effusion, often presenting with symptoms like night sweats, weight loss, and persistent cough. A lung abscess, which is a collection of pus within the lung tissue, can extend to the pleural space, causing an effusion. Lung cancer. Tumors within the lungs can directly invade the pleura, causing irritation and fluid buildup. Metastatic cancer, where cancers from other parts of the body such as breast, ovarian, or gastrointestinal cancers spread to the pleura, can lead to effusion. Mesothelioma, a rare cancer of the pleural lining often associated with asbestos exposure, can cause significant pleural effusion. Pulmonary embolism, a blood clot in the pulmonary arteries, can lead to inflammation and leakage of fluid into the pleural space. This can cause sudden chest pain and shortness of breath. Risk factors for pulmonary embolism include prolonged immobility, recent surgery, cancer, and certain genetic conditions. Liver cirrhosis. This can cause a condition called hepatic hydrothorax, where fluid from the abdomen leaks into the pleural space due to increased pressure in the portal veins and decreased protein levels in the blood. Patients often have symptoms of liver disease such as jaundice, ascites, fluid in the abdomen, and variceal bleeding. Kidney diseases. Conditions like nephrotic syndrome and chronic kidney disease can lead to fluid overload and low protein levels in the blood, both of which can contribute to pleural effusion. Hypoalbuminemia. Low levels of albumin in the blood can reduce the oncotic pressure, leading to fluid leakage into the pleural space. This can occur in conditions like malnutrition, liver disease, and nephrotic syndrome. Trauma. Injuries to the chest can cause bleeding or fluid leakage into the pleural space, resulting in hemothorax or pleural effusion. Drug reactions. Certain medications can cause pleural effusion as a side effect. Examples include drugs like methotrexate, amiodarone, and certain chemotherapeutic agents. Pancreatitis. Inflammation of the pancreas can lead to fluid leakage into the pleural space, particularly in severe cases of pancreatitis. These causes illustrate the diverse and multifactorial nature of pleural effusion, highlighting the importance of thorough clinical evaluation and diagnostic investigations to identify the underlying cause and guide appropriate treatment. Patients with pleural effusion may experience a variety of symptoms, including shortness of breath, chest pain, especially when breathing deeply, cough, fever if the effusion is due to infection, general discomfort or malaise. To diagnose pleural effusion, several investigations may be carried out, such as physical examination, listening for decreased breath sounds or dullness on percussion, chest X-ray, to visualize the fluid in the chest cavity, ultrasound, to detect the presence and extent of fluid and guide thoracentesis, CT scan, for a more detailed image and to identify the underlying cause, thoracentesis, a procedure where fluid is removed from the pleural space with a needle for analysis to determine the cause of the effusion. Treatment for pleural effusion depends on the underlying cause and the severity of symptoms. Therapeutic thoracentesis. To remove fluid and relieve symptoms, treating the underlying cause. For instance, antibiotics for infections, diuretics for heart failure, or chemotherapy for cancer. Pleurodesis. A procedure that involves introducing a substance into the pleural space to cause the layers to stick together and prevent further fluid accumulation surgery. In some cases, surgery may be necessary to drain the fluid or to treat the underlying condition causing the effusion. Pleural effusion is a serious condition that requires prompt diagnosis and treatment. If you experience symptoms such as shortness of breath or chest pain, it's important to seek medical attention. Early intervention can significantly improve outcomes and quality of life. Thank you for joining us for this discussion on pleural effusion. Stay healthy and informed.